When treating cancer, some of the treatments used to save your life could also cause lasting damage to your heart. This is especially true if you are at risk for heart disease. And Dr. Wissam Abdallah is a cardiologist at Spectrum Health, part of a team that monitors every stage of cancer treatment. Thank you for being here today.
Thanks for having me.
So let's talk about that. Of course, a lot of us know someone or more people that have had treatment for cancer. What is it exactly that is risky when they get that treatment?
Sure, absolutely. Well, you know, we've had a lot of progress in terms of screening, diagnosing, and treating patients with cancer, and also the survival rates of cancer patients has improved. But unfortunately, some of the treatment modalities we use to treat the cancer may actually have an effect on the heart. So a lot of the several of the chemotherapy agents might cause heart failure, might cause heart attacks, chest pain, might affect the blood pressure, even, causing either low or high blood pressure, and some of these medications might also cause abnormal rhythm problems. And the patients who are at risk for developing this are patients who have known heart disease, but also patients who have risk factors for heart disease, meaning they've had diabetes for a long time, uncontrolled high blood pressure, cholesterol problems, strong family history of heart disease. So these patients are more vulnerable to develop potential damage to the muscle of the heart as a consequence of some of the chemotherapy regimens that they might be receiving.
Is it chemotherapy specifically, or is it other things? And what exactly is happening to the body when chemotherapy is done?
Yeah, so chemotherapy is a very broad category of medication. So, you know, we have agents that really are not very targeted. They just target cells that are rapidly dividing. And then there are more targeted chemotherapy medications that target specific receptors or molecules on the cells. And both of these agents and various, whether they are targeting kind of cells that are rapidly dividing or targeting specific cancer cells, we're learning a lot that these regimens can affect the muscle of the heart, the normal healthy cells of the heart. And some of that is reversible, some of that unfortunately might be permanent. And so our goal is really to identify these patients who are at high risk for these potential damage to the heart muscle.
Right.
And optimize their medications to hopefully prevent any potential damage to the muscles of to their heart, and if also to screen them sooner than later to identify early signs of potential effects, so that we can start treatment sooner than later to hopefully prevent any further damage and might be able to even reverse some of the damage that may have developed as well.
Right. I bet that's a big surprise to some of your patients who come in and say, okay, you're going to help me with my cancer, but then now I'm at risk for maybe some other things, or my heart is weakening too. But I know at Spectrum Health, you really have a team approach. And so it is not just you, your cardiologist, who's working with a patient. It's a lot of other people who can really help in all aspects of wellness.
Absolutely, absolutely. It's really a multidisciplinary approach. We have a cardio-oncology program that is comprised of cardiologists, medical oncologists, and various other cancer specialists who we really focus on this multi-discipline approach to care of the cancer patients. You know, obviously the primary goal here is to treat and cure the cancer, hopefully, but we also want to be cognizant of any potential side effects some of these medications might have on the heart. And it's really not just chemotherapy, also some of the radiation patients might receive to the chest that can have long-term effects also on the heart as well. So yes, we do have a very you know, multifaceted approach to patient care, and it's really identifying those patients who are at risk for potential heart damage to help optimize their cardiac status as they undergo treatment and monitor them afterwards to hopefully catch any potential early damage, and we can start treatment sooner than later. And so we assess patients clinically. We utilize various advanced imaging techniques to try to see and identify, are we catching a potential problem before it progresses? Patients might be completely asymptomatic, really don't they don't necessarily have to have symptoms of heart failure for us to say, oh, now they have damage to the muscle of the heart. There are certain parameters and imaging findings that can suggest an early sign of potential damage to the heart before patients actually have any symptoms.
Yeah, well, this is the month of February, and so we are talking a lot about the heart. In many forms.
Yep,
we want to thank you for coming in, Dr. Abdallah, and helping us out. And of course, we have the information there if anybody wants to seek a second opinion. We'll put all that information online as well. We'll be right back with more at West. Thank you.
Thank you.
Are you West?